Good evening, ladies and gentlemen. Pursuant to instructions from the President of the United States, the Honorable Donald J. Trump, the Governor of the State of Georgia, Honorable Brian Kemp, as well as the Mayor's office here in Macon-Bibb County, the Macon-Bibb County Commission meeting scheduled for Tuesday, March the 17th, 2020 will be available to the Macon-Bibb County Commissioners by conference call only for the 5 o'clock p.m. pre-commission meeting and 6 o'clock p.m. commission meeting. The commission chambers will be closed to the public and press as we follow the recommendation from the White House to limit public gatherings for the next 15 days in order to slow the spread of COVID-19. Therefore, the public and press may only access the meeting simultaneously online at www.maconbibb.us or www.facebook.com/Macon-Bibb County. So if you want to tune in to those, you can, but we'll call this meeting to order and begin with a protracted amount of announcements to give our commissioners some idea and update on the status of the spread of the COVID-19 virus. We are meeting today in this new way in accordance with the guidance from the White House and the Georgia Governor's Office to limit public gatherings, and to this end, through the end of this month, our meeting tonight being made available, as I just said, via simulcast, broadcast, and we anticipate this continuing for the next few meetings. This will help limit the number of people gathered in one space to fewer than 10 and limit the amount of contact we have. We've even, in case you are viewing this by live stream, we're even sitting in a slightly different order with the clerk of the commission to my left and Commissioner Allen's seat and the county attorney to my right and Commissioner Bivens' seat to kind of separate us by at least 6 feet, all while we maintain the functions of local government. Because this is important, ladies and gentlemen, to recognize this is not a time to panic. Instead, to recognize and understand that this is an inconvenience to most of us, but to some of us, the elderly, those with underlying medical conditions, and children of small age, it can be a very serious, if not fatal, disease. So our efforts and our inconvenience are to try to separate us and keep us from spreading this virus to the more vulnerable members of our population. But again, as I say, this is not a time to panic, and we anticipate continuing to provide the services of local government, including these commission meetings. A lot of difficult decisions have been made in the last few days. These decisions are making life more difficult for the people of our community, from parents having to stay home with their children, to local businesses not seeing their normal traffic, to concerns as our first responders still work to protect the community while not knowing if they're coming into contact with this new COVID-19 virus. As we have done in the past few weeks, we're providing an update to the Commission on efforts by our community organizations on efforts to help prevent the spread of the virus, and to the public on ways in which we look to them for assistance in doing the same, because it's going to be by the cooperation and voluntary response of members of the public that we will be successful in our efforts to contain this virus and to reduce the spread of this virus, especially, as I said earlier, to more vulnerable members of our community. I want to thank our emergency management team and partners for their efforts over these past few weeks to monitor the international situation and then plan and implement how we as a community need to respond. This group includes representatives from schools, hospitals, departments, community organizations, public health, and more, all working together for the health of our community. To begin announcements from our outside partners, I want to call on Michael Hawkinson, the Public Information Officer with the North Central Health District, to give a brief update on the COVID-19 in Georgia. Mr. Hawkinson, thank you so much for being here with us tonight. Bring us up to speed on what you know, sir, about the numbers.
And thank you for inviting us today, Mr. Mayor. Some brief information on testing for COVID-19. We will say that there is guidance pushed out by the Georgia Department of Public Health that because of the state's limited capacity to test, we are focusing on priority groups, those being those at-risk populations that you previously mentioned, those older Georgians, especially over the age of 60, anybody with chronic or underlying medical conditions like heart disease, lung disease, kidney disease, or diabetes. Those that already have confirmed close contact with a confirmed COVID-19 case, and anybody that is symptomatic. And that is specifically for lab testing through the Georgia Public Health Lab. At this time, physicians can still order lab testing through private laboratories, which also offer the service. I can take any questions as needed, but I know that our update is relatively short. We continue to push those regular prevention methods that we have since the beginning of seeing COVID-19 abroad, making sure that people are practicing proper germ protection and sticking to those recommendations for social distancing.
Michael, thank you very much. Thank you for being here and for that information. Also, I understand that there is a new COVID-19 hotline being run by the state of Georgia. And if you have questions or concerns about COVID-19, that number is 1-844-442-2681, state hotline number for information about the COVID-19. So you feel free to use that. If you believe that you are experiencing symptoms of COVID-19, which include fever, coughing, tiredness, achiness, do not go to the emergency room or to the hospital. Instead, call your primary care physician or the FQHC here in Macon-Bibb County for instructions and directions. We do not want to further contaminate emergency rooms with people just coming in to get checked out. That would not be the thing to do. So please do not show up at an emergency room or health care facility. Call your doctor and get further instructions. Our focus has been, as I said before, on limiting the virus's spread by doing away with large gatherings of people, limiting our contact with people in public places, and aggressively advocating for preventive measures. To that end, multiple agencies and organizations have already taken steps to help slow the virus's spread. I'd like to take just a few minutes and highlight some of those efforts. We'll have a complete list online at www.maconbibb.us on what our partners have done. But all of our partners have posted hand washing flyers in facilities, ensuring bathrooms are fully stocked with soap and disinfectant, reviewing potential options for telework from home, and encouraging all people to take preventive measures. In addition, the Macon-Bibb County Consolidated Government has closed all of our recreation centers and are reviewing other operations as needed. The Emergency Management Agency is coordinating our local preventive and mitigation efforts. The Tax Commissioner's Office has canceled Thursday night's tax relief seminar, is limiting lobby access at their office, and encouraging the use of online and drive-through services. The Middle Georgia Regional Library has closed all branches beginning Monday, March the 16th. However, Wi-Fi passwords around libraries have been removed so parents can access the network from cars in the parking lot if needed. The Macon Centerplex, unfortunately, has had to cancel or postpone a number of events, including Cole Swindell, originally scheduled for March the 13th, Jill Scott for March the 20th, Disney on Ice for April the 9th through the 12th, the Avett Brothers, originally scheduled for April the 2nd. Macon Mayhem Hockey has been canceled or postponed for the games that were to be played on March the 27th and 28th. The 5th annual Macon Blues Festival, originally scheduled for March the 21st, is to be rescheduled at a later date. In addition, Newtown Macon and the Urban Development Authority have blocked off parking in front of restaurants to accommodate curbside food-to-go orders. The municipal court of Macon-Bibb County has postponed all March activities, including court arraignments and trials, which will be rescheduled. The juvenile court of Bibb County, all legal deadlines have been tolled for a period of 30 days. The probate court of Bibb County is accepting applications for marriage licenses by appointment only, so no walk-in traffic. And weapons carry permit renewals will not be offered until after Chief Justice Melton's 30-day order expires on April the 13th. The Superior Courts, all trials and grand jury proceedings for Bibb, Crawford, and Peach have been suspended for 30 days and will be rescheduled. The clerk of the Superior Court's office is limited, access is limited to staff and only essential functions such as petitions for restraining or protective orders. Schools, the Bibb County school system has moved to an e-learning or homeschool model and closed classes until further notice. The Macon Transit Authority has been conducting additional routine and thorough cleaning and disinfecting of buses every 2 hours, and colleges are moving to online classroom models and asking students to stay home. The Macon Water Authority is temporarily closing its customer service lobby at 792nd Street and encouraging people to use the drive-through windows at that location, 792nd Street. And Visit Macon, our Convention and Visitors Bureau, is working with all events and group tours and meetings that are looking to cancel events in Macon but get them rescheduled. In addition, our hospitals have been working diligently to try to combat and come up with programmatic ways to help our community through this COVID-19 situation. I'd like to invite Dr. Sanford Duke, the Executive Vice President and Chief Clinical Officer for Navicent Health, to take a few minutes now and come to the podium and tell us on what they're doing at Navicent. Dr. Duke, thank you for being here. You're recognized, sir.
Thank you very much, Mayor. Thank you, commissioners and others, for being here today. It's a privilege to have an opportunity to speak to you on behalf of Navicent Health and the efforts that we are making to combat this crisis. First, I'd like to thank Coliseum and their partnership throughout this process to care for the members of our community. I want to reassure the community that we are committed to battling this disease and winning on behalf of our citizens. We're taking great efforts to minimize the impact of COVID on our community. First, I want to speak about visitation. Last week, we began limiting access to our facility for the protection of our patients, our teammates, and our providers. It's a fluid process, and I ask for patience from those trying to visit the facility. We're doing this to try to limit the possibility of COVID spread within the hospital. Second, we've taken some drastic steps to limit large gatherings. So classes, support groups, those have all been put on hold, much like those that you've read. We've closed our wellness center and our employee wellness center. We're taking efforts to minimize the possibility of entrance into our facility. Second, I want to speak a little bit about testing. You've heard a lot in the press about access to testing. We are actively testing. We're following DPH guidelines. Patients that come in and meet medical screening criteria have access to testing, and we are getting those back regularly. And as mentioned earlier, we also have access to commercial laboratories, and we are utilizing those with great success. Finally, I'd like to say, I urge all citizens, we have the opportunity to blunt this curve. We have time. There are no cases in our community right now. Now is the time to be careful and to be diligent, and we can blunt the spread of this. It is coming. We are prepared. But if we can slow down the spread, we can potentially prevent a surge that would strain our medical system. I also urge everyone to consider the source of information. Please reach out to the Department of Public Health, CDC, our website, navicenthealth.org, or any reputable source of information. Thank you very much.
Dr. Duke, thank you very much. I appreciate you being here. Now I'd like to invite Dr. Richard Rubio, the Chief Medical Officer for the Coliseum Health System, to take a few minutes and bring us up to speed on what they're doing. Dr. Rubio, thank you very much for being here, sir. You're recognized.
Thank you, Mayor, and thank you for inviting me. I too would like to thank for the partnership of Navicent Health with preparations in learning and sharing experiences in how to combat COVID-19 and making preparations for such. At Coliseum Health System, which includes our 2 campuses, Coliseum Northside Hospital and Coliseum Medical Centers, our preparations began almost 2 weeks ago, where we began limiting access entry into our hospitals. We have 1 access point at each of our emergency rooms and a 2nd access point at each of our main entrances. At these 2 access points for each facility, we have individuals who screen all visitors, vendors, and patients who enter into the hospital. And we ask some of the screening questions, including if the individual has a temperature, any lower respiratory symptoms such as shortness of breath or cough, or if they've had any contact with anybody diagnosed with COVID-19. If the answer to any of these questions is yes, then we provide them a mask and we ask them to please go back home. Now, when they do go back home, we advise them to contact their primary care physician. If they do not have a primary care physician, we do have a 24-hour hotline that we recommend them to, that's offered by Coliseum Health System, which is 478-746-4646. So that's just another way they can get some information and guidance on how to navigate through this. We've also instructed all of our hospital-based medical staff to not come to work sick. So if they have any respiratory symptoms, we've asked them to not come into work, and we've been in contact with the respective directors on getting replacement staff for that. We've also been very prudent with educating all of our employees. As they're doing in Navicent, we're also limiting large gatherings. So all meetings that include persons greater than 10, we are holding those meetings via teleconference. So these are just some of the many other things, in addition to some of the routine things that we are all educating people on, as far as hand washing, social distancing, and isolation that we're doing at Coliseum Health System.
Wonderful. Dr. Rubio, thank you very much. It's quite apparent that both at Navicent and Coliseum, extensive steps are being taken to help protect the health of our community. But I think I speak for the medical community when I say we cannot do this alone. The hospitals and the government cannot do it. We're going to have to rely on individual response from members of the community. And I would join the governor, Governor Kemp, and the president in asking everyone to take responsibility for themselves and their family, to limit your potential exposure, and especially to curtail any activities where you might transmit the virus to more vulnerable members of the community. Do not visit nursing homes unless it is a member of your immediate family that's in extreme circumstances that needs you. Those are the people that are most at risk. Stay away from daycare centers for children or groups of children, because they also are at risk. And for heaven's sakes, don't go to see a friend who is recovering from cancer and may be having treatments, either radiation or chemotherapy, that can suppress or reduce the immune system. You need to learn what the symptoms are and talk with your doctor if you exhibit signs, but most importantly, learn how to properly prevent the spread of this disease. So I want to thank our doctors here, but I also want to recognize and call on Dr. Jeff Stevens, who is an infectious disease specialist, to talk about the steps that we as individual citizens can do. Dr. Stevens, thank you, sir, for being here. You're recognized.
Mr. Mayor, thank you, members of the commission. Again, following up with my colleagues, I think the message can't be said enough to try to flatten the curve and decrease the spread of this. I mean, these are very simple things: appropriate hand washing, warm water, soap, do your ABCs while you're doing it, count to 20, use hand sanitizer that's appropriate, avoid touching your face and eyes, especially if you're going to do that. Make sure you've washed before that. cover your cough and sneeze, the old in the elbow. My kids are much better at that than probably I was for a long time. And again, staying home if you can. Telework, work from home. Social distancing, we've talked about that. If you have to be around folks, try to stay 6 feet back. Again, that really helps because if you're coughing, the droplets drop out. Again, that's the whole idea of that. And as Dr. Duke and as Dr. Rubio, we can spread this out. We can slow this down and flatten the curve, and that will allow us to deal with this in a much better and easier manner.
Excellent. Thank you very much, Dr. Stevens. We appreciate you being here tonight, and thank you for your hard work on our behalf. With people staying home, this will have an impact on our local businesses, and I think we should do what we can to support them as much as you can. It could mean ordering food to go. You can limit your contact with delivery drivers, or you can take advantage of the new curbside services being offered. Tipping an extra couple of dollars and ordering products online from local vendors can all help. Our friends and families rely on you to support their businesses, and we can help them through this difficult time as well. Just today, my staff and I ordered food from a local restaurant so that we could support a local business while practicing the social distancing that Dr. Stevens just talked about. Again, while this rapidly spreading disease may add some difficulties and inconvenience to our lives, it is proving deadly to other people, especially senior citizens, persons with underlying medical conditions, and children under the age of 5. By working together, though, by following the recommendations of doctors and public health officials, we can protect the health of our community, and I know we'll do so. Thank you all very much for what you're doing on our behalf. Before we begin official business at this pre-commission meeting and no other announcements needing to be made, I'm going to ask the clerk to conduct a roll call to see how many of our commissioners are on the phone with us tonight by teleconference, so we'll know whether or not we've got a quorum.
Thank you,
Janice?
Mr. Mayor. Commissioner Allen?
Commissioner Allen here.
Thank you. Commissioner Bivens? Commissioner Bivens?
Commissioner Bivens here.
Thank you, sir. Commissioner Jones?
Here.
Commissioner Lucas? Commissioner Lucas?
She was there a minute ago.
She was there a minute ago. Commissioner Lucas, are you on the phone? We may have lost her.
Okay.
Commissioner Shepard? Commissioner Schlesinger?
Commissioner Schlesinger here.
Thank you. Commissioner Tillman?
Mayor Pro Tem Tillman is here.
Commissioner Watkins?
Here.
Commissioner Wynn?
Here.
Okay, thank you.
Was anybody not?
Commissioner Lucas was the only one that didn't answer, but I thought I heard her on the phone earlier. And huh?
Commissioner Lucas, are you on the phone?
Maybe she's got it on mute.
Well, but we've got Allen, Bivens, Jones, Schlesinger, Tillman, Watkins, and Wynn that have confirmed. So that's a quorum. The first item of business concerns a change to commission procedures. And with that having been said, I'd like to call on the county attorney to explain that ordinance to you, our commissioners, to see if we can get that adopted here at pre-commission and then at full commission momentarily.
Thank you, Mr. Mayor. We do have a resolution that we're asking the commission to consider and pass regarding the open meetings procedure. Under the Open Meetings Act, as well as the Georgia Constitution, when you have a health emergency that's been declared, such as the one we're in now, it allows counties to conduct meetings by teleconference like we're doing now when necessitated by those emergency conditions. The requirement of the law is that the public and press have simultaneous access by broadcast, which we're doing now, even if they're not attending in person. And so we have got a resolution, Mr. Mayor and members of the commission, drafted. And let me, with your indulgence, can I read the pertinent parts of it?
Yes, please, if you would.
Okay. It's titled, "A Resolution of the Macon-Bibb County Commission Establishing Commission Meetings Procedures for the Foreseeable Future in Response to the COVID-19 Pandemic and for Other Lawful Purposes." And I'm going to read the pertinent parts of the change or proposed change in this resolution to our procedures. Now therefore be it resolved by the Macon-Bibb County Commission, and it is hereby so resolved by the authority of same, that the ordinary procedures for meetings of the Macon-Bibb County Commission and the committees thereof shall be hereby modified as follows until further notice. Number one, all meetings of the Macon-Bibb County Commission or the committees thereof shall take place in the commission chambers at the Macon-Bibb County Government Center. Number two, Macon-Bibb County Commissioners shall participate in any or all commission or committee meetings by teleconference in accordance with the Open Meetings Law. Number three, meetings of the Macon-Bibb County Commission and the committees thereof shall be live streamed on the Macon-Bibb County Facebook page, and the members of the media and the public are required to view those meetings remotely rather than attending in person in order to minimize the risk of transmission of COVID-19. Number four, the mayor shall be authorized to take any actions necessary to limit the number or proximity of individuals attending any meeting of the Macon-Bibb County Commission or the committees thereof, or to provide for any person having business before the commission or any committee to participate remotely as able. And finally, the mayor shall be authorized to terminate or modify the procedures set out in this resolution as necessary and in accordance with the law in order to adapt to the changes in circumstances as the COVID-19 pandemic progresses or resolves. So that is the pertinent parts of that resolution, Mr. Mayor.
Thank you, Duke. Do I have a motion and a second to adopt the resolution concerning these meeting procedures?
Commissioner Wynn.
I've got a motion and a second, and if you would please, when you make a motion, because we may not be able to recognize your voice, state your name and say state your name and what your motion is or your second.
Wynn.
Okay.
Got a motion by Commissioner Jones, a second by Commissioner Wynn.
Got a motion by Commissioner Jones and a second by Commissioner Wynn. Is there further discussion?
I have one thing I'd like to mention.
Yes, sir. Commissioner Bibb.
I'm going to vote for it, but I'm having a little trouble understanding, so I just like to get a copy when I can.
Yes, sir. Absolutely. Be glad to get you a copy of it and answer any questions about it. But basically speaking, I think the county attorney summarized it when it says it's authorizing us to attend these meetings by teleconference without a quorum being physically present here, conducting the meetings in the chambers as opposed to a committee meeting room behind us. Those are the main things, and doing the simulcast on our web page and Facebook page so that members of the public and media can attend these meetings that way rather than being here. So it limits public access physically to the meeting room, but that's essentially what it does. Any further questions?
Commissioner Lucas is back on the line.
Thank you, Commissioner.
Good. Glad you're with us. Any further questions or discussion on this item? Hearing none, all in favor of the resolution signify by saying aye.
Aye.
Opposed, no. The ayes have it, and the resolution is adopted. Thank you very much.
One more thing, if you would allow me, for procedural purposes.
County Attorney, yes, sir.
If I would make a suggestion, because of the unique nature of the teleconference meeting and the fact that y'all are on a line, if for purposes of any kind of action, either motions, seconds, or any discussion on agenda items, if everybody who wants to speak can please clearly identify themselves by name first, then either make your motion or your second, and then discussion as is appropriate on the agenda item. And when voting, please clearly state aye or no, as you've done just a second ago. That's for us to keep up with the vote. And if we need to, and if we can't understand the vote, we'll do a roll call. So that's the procedural ground rules, Mr. Mayor.
Good. Any further questions about procedural, about the process we're going to employ going forward tonight? If not, the next
Mr.
item.
Mayor, Mr. Mayor,
Yes, ma'am.
Mayor, this is Commissioner Wynn. I think if, like, the attorney or somebody would be closer, I can hear you fine, but we're not hearing them as well because they're not as close to the phone as you are.
Okay. If I have something, I'll come over there.
Okay. Okay, thank you, Commissioner Wynn. Yeah, we'll try to make one of these little remote microphones, get it a little bit closer to the county attorney so that you can hear him. The next item on the agenda for pre-commission is for me to review tonight's main commission agenda. And I'll do that very quickly because we've changed some of the order. We do not have a preacher to give us an invocation or anyone here to lead us in the Pledge of Allegiance. I may lead us in the Pledge of Allegiance just to get us started. But then the first item on the agenda after we get through with the Pledge of Allegiance is going to be the formal adoption of what we just approved as Committee of the Whole. That is, this resolution establishing commission meeting procedures for the foreseeable future. That's what we just discussed and just talked about, but that'll be formally adopted at the beginning as first item of business tonight. Following that, we'll ask for approval of the minutes of the pre-commission meeting of March the 3rd and the regular commission meeting of March the 3rd. Then we'll have reports from our standing committees. Chairman Watkins will give us the report from Operations and Finance. Chairman Lucas will give us the report from Economic and Community Development. I do not believe that there was a public safety report or facilities and engineering report. We'll then go to the consent agenda. There are a couple of new alcohol licenses that I'll go over in depth with you momentarily, but both of them are in the downtown area for bars and or the new Tapas. I didn't say topless, I said Tapas bar on 2nd Street. But I'll get to those in more detail later. There are only 2 items on the consent agenda. Then we'll go into old business. And under old business, we have a series of reappointments. The first being Gene Bragg to the Keep Macon-Bibb Beautiful Commission. The second one being to appoint Paul Bronson to the Keep Macon-Bibb Beautiful Commission. The third being to reappoint Martha Carter to the Keep Macon-Bibb Beautiful Commission. The fourth is to appoint Michael Jameson, Jr. to the Fort Hawkins Board. The next is Monica Swain, appointment of Monica Swain to the Board of Directors for River Edge. And then Grace Guyton to the Region 2 Department of Behavioral Health and Developmental Disabilities Advisory Board. And then Dr. Charles W. Callender, appointment to fill the unexpired term of Rick Hutto on the Urban Development Authority, and a resolution to confirm the reappointment of Don Banks to the Bibb County Civil Service Board, and a couple of pension committee appointments, reappointing Narendra Bardwaj as to the Retirement Board for Macon Pension and Retirement System Division A, and Charlotte Woody to serve as a member of the Retirement Board, Macon Pension Retirement System Division A. And all of those appointments were heard and approved, and the Economic and Community Development Committee recommends approval of all of those appointments or reappointments. Questions, comments about all those? Next, item K is a resolution authorizing the mayor to execute an agreement with Advanced Disposal for the collection of household garbage and recycling throughout Macon-Bibb County for a term of up to 9 years. It's a 5-year contract with two 2-year renewals. This is the contract that was out for bid, and Advanced won the low bid, and it's actually about $1.05 less than their current rate that we're charging. Operations and Finance Committee heard that and recommends approval. Item L is an ordinance to repeal the requirement that applicants must obtain a certificate of occupancy, occupation tax certificate in order to receive a temporary alcohol license. This basically allows people to get a temporary alcohol license while their premises are still under construction. That allows them to start working on their state license, because you got to have your local license before you can get your state license. It takes several weeks to get the state license, and then when you do get the state license, you still have to have a certificate of occupancy before you could open, but it allows you to open with your alcohol licenses in place. Questions, comments, or concerns about any of those?
Mr. Mayor.
Yes, sir. Mayor Pro Tem.
Pro Tem Tillman. Just a comment to everybody. If they're not speaking, to just mute the phone. This way we'll be able to clearly hear you and anybody that may be speaking. Thank you, sir.
Good idea. Thank you, Mayor Pro Tem. Should have said that. Yeah, if you're not speaking, please mute your phone so that you cut out any background noise or comments you don't intend to be heard. Next, item M is a resolution authorizing the acceptance of a Criminal Justice Coordinating Council of Violence Against Women Act grant in the amount of $50,000 with a required match in the amount of $16,667 to be paid out of the general fund. Operations and Finance Committee recommends approval of that. Item N is a supplemental appropriation from the Lake Tobosoffke Recreation Area Fund balance in the amount of $64,600 for various line items within Lake Tobosoffke to fund startup costs at Sandy Beach and pay utility costs. Operations and Finance Committee heard that and recommends approval. Item O is an ordinance to approve a supplemental appropriation from fund balance in the amount of $33,000 to the general fund and transfers from other funds commissary line item and $33,100 from the sheriff's commissary fund balance to come up with a total cost for the sheriff's surveillance camera program. Operations and Finance Committee recommends approval of that. Item P is an ordinance to amend the Bibb County Sheriff's Office budget by transferring $845,000 from salaries and wages to part-time or overtime cost line item. So he's shifting money within his balance to pay overtime. And item Q is the same thing for the fire department, shifting a little over $1 million from salaries to overtime to cover overtime costs because of shortages. Operations and Finance Committee heard those and recommends approval. Item R is a resolution authorizing the mayor to execute a guaranteed energy savings performance contract with Schneider Electric. That is new business that we'll have to go back to the pre-commission meeting to take, so that we'll have it on the evening agenda as item R for final approval. And the same with item S, which is an ordinance to amend the Government Policies and Procedures Manual. So we'll get to that as new. But that's all. We've got some new business that I'll read and refer to committees to close us out under new business, and then that'll be the end of the meeting tonight. We've only got about 8 or 9 items of new business ready to be referred tonight, but there may be more between now and the end of the week. As now going back to the pre-commission agenda, we've got a couple of items of new business. The first would be these 2 alcohol licenses that I need to get to. The first one is by Niche, N-I-C-H-E, Niche 385 LLP, doing business as Niche 385. They're located at 385 2nd Street. This is for liquor, mixed drinks, beer, and wine to be consumed on the premise at that location. It's got the sheriff's certification that a satisfactory background check was done. It's got the certificate from the Business Development Services to say that the appropriate license fees have been tendered. Planning and Zoning has got their certification here, along with the engineer's form and the ad that ran in the Telegraph. So that's for Niche 385 2nd Street. The next is Lazy Susan Tapas Bar LLC, doing business as Lazy Susan Tapas Bar, 428 Second Street. So they're within a block of one another on Second Street. And the Tapas Bar, the applicant is Ron Smith for the Lazy Susan Tapas Bar. It's for liquor, mixed drinks, beer and wine to be consumed on the premise. Also got the planning and zoning requirement, sheriff's background check, and business license fees and measurement forms in the ad that ran in the paper. Anybody got any questions, comments, or concerns about either of these alcohol license applications? If not, can I get a motion and a second?
I have a question, Billings. You mentioned the topless bar. Can you explain that?
Yes, sir. As I understand it, a tapas bar, T-A-P-A-S, tapas, is a small plate. So it's kind of like appetizers and things like that. So as I say, it's hard for me to pronounce tapas and not you to think topless. But this is not a topless bar, it's a tapas bar.
I think we were hearing it as topless.
Oh, I'm trying to do the best I can. It's a tapas, it's a small plate bar. Can I get a motion and a second on those two license applications?
So moved. This is Lucas. So moved.
Got a motion by Lucas, second by Wynn. All in favor of issuing those two license applications signify by saying aye.
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 Any opposed say no. The ayes have it. Those will be on the agenda for the 6 o'clock meeting. Next, we've got a couple of items of new business. The first is we sent out to you last week. This is for a resolution authorizing the mayor to execute a contract for guaranteed energy savings performance with Schneider Electric. We've got Rob Riles on the phone, and I think that Trent Egbert is also on the phone from Schneider if there are any questions, but I understand this is necessary to get this done because one of the significant cost savings contracts expires and is no longer enforceable by Schneider Electric at the end of March, and this is our last meeting before the end of March. Rob, are you there, and can you speak up to this at all?
Yes, sir, that's correct. The communications contract has some promotional offers that they have already extended. The figures in their proposal that was given to us is 6 months old at this point, and they just can't continue to secure those promotional guarantees.
Are there any questions, comments, or concerns about this resolution to authorize? This is the $23,447,469 contract for these guaranteed energy savings, which will repay the cost of the bonds plus some. Any other questions, comments, or concerns? If not, can I get a motion and second to adopt the resolution?
So moved.
Wynn.
Got a motion by Lucas, second by
No, it wasn't me. Yeah, it was Larry
Wynn.
Schlesinger made the motion.
Schlesinger made the motion and Lucas was the second?
Yeah.
Okay.
No.
Well, we got a motion and a second by Lucas and Schlesinger. Is there further discussion?
Oh, well.
Hearing none, all in favor of the resolution signify by saying aye.
Aye.
Opposed say no. The ayes have it, so that'll be on the agenda for official approval tonight momentarily. I think it was item R, but it's down toward the end. And the next is an ordinance to amend the Government Policies and Procedures Manual so as to create a new section called the Alternate Work Schedule Policy. And I'm going to ask the county attorney to kind of slide down this way or maybe even take my seat so that my microphone will pick pick up for those on the phone, and he can explain this to you. Mr. Attorney, let's swap seats, please, sir.
Thank you, Mr. Mayor, and Dr. Duhart is here as well. If you have any questions about the specifics of how this would apply. But basically, the recommendation or the ordinance, if it's adopted, would adopt an alternate work schedule policy and would create different categories of work schedules that will be basically monitored by and enforced by department directors. And I'm going to ask Dr. Duhart to come up and help me with this because she's the one that helped. I think she drafted the whole thing. It creates flex time, telecommuting, what's called compressed work weeks, and it talks about basically when and under what circumstances employees can do all of that. So with that background, I'm going to turn it over to, you want to come up here? Can she?
She is on. Go ahead.
I think it's on.
Okay.
So the policy, what it does, it permits our department heads to allow the employees to work staggered hours, as well as flex time, as well as those employees that have the capability to telecommute. It also allows them to telecommute as well.
I'm sorry, I can't understand.
Come on up here.
Yeah.
Yeah, that'd be fine. We're gonna bring Dr. Duhart up to my seat so that she can, there's a little microphone up front. Thank you, Dr. Duhart.
Okay, this policy, it permits our department heads to to schedule staggered working hours for our employees as well as flex time. Also, those employees that have the capability of telecommuting, working from home, will be allowed to do that.
And it gives the department directors a lot of latitude in how they're making sure that the employees are working either their core job responsibilities or giving them extra time to do things they need to do because of the crisis. Is that fair to say?
Yes.
Okay.
Is this though a permanent thing, or is it going to be just for this time?
Is it permanent
or just for this
or
amount
is
of
it
time?
just for a certain period of time?
So this will be permanent.
That's what I was understanding. It is a permanent thing.
It's permanent, but it allows the mayor to also terminate it.
Well, I just wondered, I know it says the supervisor, it will be at the director's discretion to decide who gets to do flex time or whatever. But I don't know, how are we going to oversee this and know that these people are working hours they're supposed to be working? I'm just concerned about that.
This policy can also be used in inclement weather situations as well, not just the current situation.
I understand that. I'm just concerned about how is it going to be overseen by the supervisors or the managers or the directors of these people that take flex time? And what departments are you thinking can do flex time?
Commissioner Wynn, this is Keith Moffitt. I've met with
Yes,
the department heads and the elected officials twice in the last 4 days to talk about this policy. One of the things is they have to notify HR of any employee that will be not in the office. For one, that way we can monitor and also know how to account for time and things of that nature. The second one is that we did ask the department heads that we understand that we're operating in a new day and age with technology, with certain things such as the inclement weather. We've had to do this in the past, so we thought it would be best to go ahead and document a policy which would allow for certain guidelines that would allow for extenuating circumstances. IT department is working with employees to make sure they have the appropriate logins and credentials to work from home if need be. We do know that when the school system did close, that we did have some employees that had to make emergency decisions about childcare, and we did not want them to have to be in a situation when they decided to leave a child at home. So those employees, again, they have to notify, the department head has to notify HR so we can keep track of it and account. And so we do have that information, and this policy will allow us to govern ourselves accordingly.
Would what departments do you think can do teleworking?
The one that I'm most concerned about is finance and payroll, for one. That's one that I'm making sure, because we do not want any hiccups during this time of uncertainty. Other departments that we've looked at, this particular policy is some HR duties, any administrative functions that use at least 95% of the computer.
I just know that I spent the majority of my career teleworking for various companies, and they were always able to put a thumb on where you were in your work and can keep up with it on a daily basis. I just don't know how we're going to do that here. I know you said you talked about it, and I'm sure the supervisors and directors have ways to do it. I just have a concern of which departments you're going to do that with, and is it going to be something they can do anytime they want to, or is it going to be a permanent?
No, ma'am. Again, it has to be and HR has to be notified. It has to be approved. And in talking to the department heads and the elected officials, everyone pretty much understood that.
It's in the policy.
And it's in the policy, and it's written in the policy.
Each time someone wants to telework them, they've got to get it approved by their supervisor or manager.
Right, and HR.
That's right.
Yes, not just the manager, but the manager has to get it approved through HR.
So it's not a permanent thing, and it'll only be used occasionally, or be used permanent?
Well, it's a permanent. As of today, we're recommending a policy change, which all policy changes are permanent until you modify them again. But again, it has to be approved by the department head. Has to submit it for approval to HR.
This is Luke. This is Commissioner Lucas, and I have some similar concerns because I know of one department, Board of Elections, where there's been some questionable time or request for this kind of leave, and so I really would like to have a little more time on it. I know exactly why and I know that it's one of those things that we need to put into the policies, but I would like to have some time to have a few more questions answered. Do y'all have to put it in place right now, or could we have a couple of more weeks to kind of think through it, ask some questions? Because I have a whole lot more, and we don't have time. So could we possibly table it for 2 weeks and kind of have some more discussion about the specific department? Would that hurt anything?
I'd like to second that table motion because I have the same concerns. That's why I was asking all those questions. We need to talk about it and look at it some more.
Mr. Mayor.
All right, I'm back in my chair now, and I have a motion by Lucas and second by Wynn to table this for a little further discussion. That's a non-debatable motion, so all in favor of tabling this, would you please signify by saying aye?
Aye. Aye.
Opposed, would you say no?
No. I want to say this is business. I want to say no because I can understand how this gets function.
Okay, but it sounds like I had several ayes and only a couple of noes. In the opinion of the chair, the ayes have it and the motion is tabled. Anybody want to dispute that and have a roll call vote?
Roll call vote, Allen.
Okay, roll call vote on that, so we'll be sure. This is on the motion. This is on the motion to table. I'll ask the clerk to go down the roster, please.
Commissioner Allen, how do you vote?
On the motion to table.
On the motion to table, Commissioner Allen, how do you vote?
I vote to table.
Okay. Commissioner Allen votes yes. Commissioner Bivens?
Vote to table. Not table, excuse me. Commissioner Bivens, I vote. I didn't want to table, vote not to table.
No.
So you vote no.
No.
Commissioner Jones? Commissioner Jones?
Hello.
Do you vote to table or not table?
keep going.
Okay, Commissioner Lucas,
Yes.
Commissioner Schlesinger,
No.
Commissioner Tillman,
Yes.
Commissioner Watkins,
No table. No to table.
Commissioner Wynn.
Yes.
Okay, so you have, Commissioner Jones, are you there? So you have 3 noes, Mr. Mayor, and you have 1, 2, 3, 4 yeses.
Well, we need 5 to pass anything, so the motion to table fails, so that just brings us back to further discussion on it to see if we can allay any fears or concerns. The first thing I would say is, number one, in the situation in which we currently find ourselves, we have a number of employees who either already have notified us that they're not able to come in because they have to stay home with children, or that they need more time to make arrangements for children and can't come in. So if they are not allowed to work from home and earn money working from home, they are in a real dire strait. So we're kind of trying to accommodate some of those folks this week with it. Is it a life or death thing? Does it need more study of this, that, or the other? That's kind of what we're talking about. Any additional comments, Dr. Duhart, from you or Dr. Moffitt from you?
Is it my understanding?
Yes, ma'am.
Wants to say something.
Who?
Commissioner Bivens? Do you
Yeah,
have
I can understand the urgency of this, and it seems we do need to go ahead and allow it now. But I would like to have a review in a couple of months to see how it's gone and if there needs to be any adjustments to the policy. But I can understand the need to do it immediately because all these kids are out of school. Arrangements have to be made. So I can see the urgency, but I would like to review it in a couple of months. And I don't know if that can be made into a motion or what.
Mr. Mayor, this is Lucas. The mere fact that we were trying to table this does not preclude the county manager from making decisions in this crisis. What I would like to do is for us not to put something permanently in place, although I know that there's eventually a need for us to do this. I don't want us right now to put something permanently in place until we discuss 2 specific situations and departments where there is a potential for abuse because of some things that I'm aware of that I don't want to discuss publicly right now.
That's fine.
So that was why I was asking us to table it, because I know that the county manager and the mayor can cover us for right now. But allow us to kind of discuss for the next couple of weeks, and I want to present to the other commissioners the specific situations so that we can deal with those before we put something in place and allow, the behavior to be in place. That was my only thing. I just didn't want to put it in place before we heard the other information.
I understand. And that's fine. That's fine with me. We can certainly discuss this more. Where we are right now is we had an insufficient number of votes to table it. So I need a motion to either refer it back to committee or to pass it or to disapprove it. One of the 3.
Well, I don't want to disapprove it. I want us to eventually approve it, but I want it to go back to committee. So I'll make that motion to refer it back to committee.
Okay.
And I second that.
Okay, so now we got a motion to refer it back to committee for further study and evaluation, which is only slightly different from a motion to table, but at least it's to, referring it back for further action. A motion by Lucas, second by Wynn. Further discussion on that motion to refer it back to the committee of the whole next week for further discussion. Hearing none, all in favor of referring it back to the committee for further discussion?
Excuse me.
Commissioner Wynn would like to say something.
I'm
Go-
trying to say something.
Commissioner Wynn?
I agree with exactly what Commissioner Lucas was saying. We need to review this. You can make emergency decisions right now, but I don't want to make a permanent decision until we look into it further. You just kind of threw this on us. We all know it's emergency. The administration needs to take emergency steps on their own. But let us look at this policy for the future before we put it in place. That's why I'm saying let's put it back in the committee to study it.
Very good. Is there further discussion then on the motion to refer it back to committee for further discussion next week? Is there further discussion? Hearing none, all in favor of referring it back to committee of the whole for next week, signify by saying aye.
Aye.
Opposed, no. The ayes have it. We'll refer it back and discuss it next week in committee meeting. And thank you very much for that. It is now 6 o'clock, so that is all of the business for the pre-commission. And at this point in time, can I get a motion to adjourn the pre-commission meeting?
So moved. Larry Schlesinger.
Got a motion and second to adjourn. All in favor of adjourning the pre-commission meeting signify by saying aye.
Aye.
Opposed, no. The ayes have it, and we are adjourned.